Hi, I'm Heidi Basfield, Executive Director of Speak Our Minds and Speak Our Minds podcast. Suicide remains the leading cause of death for our nation's youth. It's nothing short of a continued public health crisis. And on this series, we wanted to team up with providers and talk about what children's hospitals and their teams throughout this country are doing to take on this challenge and work every single day to have things be different, better for our youth. As part of this series, you'll hear from those providers, their teams, and what they're up to. They'll talk about new practices that they're putting into place, what they think has changed about the conversation with youth mental health, what their biggest obstacles are, what they would do about those obstacles, and what they're really excited to be a part of over the next 5 years. We also feature stories from parent caregivers who really bring home why this work is so incredibly important and how we can all join and be part of these efforts as a collective to turn the tide and prevent youth suicide. Thank you for joining us for Preventing Youth Suicide, a series focused on bringing about change. Okay, I'm here with
Bob Batterson, child psychiatrist and Associate Division Director at Children's Mercy, Kansas City.
Here's your question. If you can wave a magic wand and remove one obstacle in the world of youth mental health right now, what would it be and why?
Stigma.
Okay, well.
And why?
Yeah.
Well, we have stigma at multiple levels, but the biggies to me are stigma among the families. So they won't seek help for their kids until things are really bad.
Sure.
Because they feel like if they open that door, they're never going to be able to close it again. And all these horrible things will happen to their child. And maybe they're going to get blamed for all the problems that their kids have.
Right.
And then stigma among our general hospital administrations around the country and around insurers and around our legislators that feel like mental health is a giant black hole into which you can dump as much money as you want and you're never going to get results.
Well, I feel like that's an amazing obstacle to remove.
And it would take a magic wand. You ask for a magic wand moment. Yeah.
I'm all for magical thinking. Bob, like to build off of this, when I also think about the role that stigma plays, even in our own hospital care environments, can you talk about over the last few years, how you've seen stigma maybe changing or not in the way that children's hospitals are thinking about, talking about, addressing youth mental health?
I think it's evolving in a good direction. It wasn't that long ago that I used to hear pediatric nurses say things like, well, I didn't go into nursing to take care of those kind of patients.
Right.
This is not the kind of pleasant, sweet little child I had hoped to help. There was sort of a sense the problems that these patients are facing are not real problems, they're behavioral problems. I've seen an evolution towards funding, towards putting more energy towards programming. In our hospital, behavior health became the central action of our hospital strategic plan in 2018, only to be fueled by the pandemic, which turned into a huge mental health crisis, as we know,
Right.
for pediatrics.
Right. Which is amazing. And what do you feel like the change continues to be as a result of elevating mental health within this world and your own sort of internal stigma reduction efforts?
Well, people are more engaged. People are more interested. Our donors are more engaged. It's kind of at the top of mind for everybody, which it never had been before.
Looking ahead, what do you most want to be part of creating in the next 5 years?
Which is perfect timing because that's probably how much time I have to go before I would retire. But what I would love to see created is a much more solid, seamless system of care. And the program that we're creating right now, which is a partial hospital program at our hospital, and also a crisis center and a med psych program, I'm very excited to be part of those kinds of programs because it's plugging up the holes, at least a few holes in our system of care. And it's very exciting to be part of because it gives me hope for the future. It gives me a sense that as long as we can prove that our programs work and have some positive impact, they're going to be a part of the future of the pediatric hospital that I have been blessed to work at for the last 25 years.
That's fantastic.
Yeah.
All right. Well, you heard it here, and we'll be excited to hear how the ongoing developments at Mercy Children's continue to produce incredible outcomes for kids' mental health. Thanks, Mo.
Thank you.